Hi, this is Guy speaking again. This is the third video demo on our CancerStat News and Intelligence platform. It'll be like the others, it'll be very informal, very brief, around 5 to 10 minutes, and I shall focus on the the drugs and treatments part of the service. Okay, so as you can see, we are tracking information on 3,335 cancer drugs and treatments. If we just scroll down here, we click on drugs, treatments, and trials, drops down here, and you can see that there are 20 listed here. You can click on any of them to see the news on them, or you can click on the See All 3,335. Page refreshes, and this is where you can search for any drug or treatment. Some of them obviously have their names. The others will have the code that they are called whilst they are under clinical trial. And what we're always keen to do is to ensure that we are tracking information on any new uh, uh, trials that crop up, um, whether they be based in the UK, the US, Australia, Canada, China, South Africa, Israel, wherever. So it's and again, this is for all different types of cancer as well. So if we have a quick look at some of these, and if you have a look at this particular uh, drug here, we will see here it's mentioned. Latest news, all news articles where it's been mentioned. Obviously, you have the percentage relevance as to how relevant the article is to the subject, which of course in this case is the drug in question. We have 30 news articles on every page, and it goes back historically. The archived boxes, like the rest of the service, have the saved copy of the news article here as well. And of course, you can switch yourself on for email alerts or daily emails on the different drugs and treatments, okay, by putting a little tick in the daily box, pressing the submit button. If we have a quick look at the top 100 links, you'll see the top 50 companies and the top 50 drugs and treatments mentioned with this particular drug, okay. So if we just scroll down here, top link companies mentioned here, top linked drugs as well. Okay, you can click on any of these to see the most up-to-date news on them. If we just scroll back up, let's have a look at another one. Let's have a look at this one here. If we click on it, as you can see, its name is therefore here. Latest news, top 100 links, email subs. An article from yesterday, and then two from a couple of days ago, and then a few, 3 or 4 from the 11th of April. Again, vast selection of different sources here. Scroll back up. Let's have a quick look at the top 100 links for this particular drug, and here we have them. Okay, so top link companies, top link drugs for this particular drug here, and so you can click on any of these companies to see the most up to date. Well, the news articles where the drug's been mentioned with the particular company. If you want to see the 16 articles, let's say 27 articles where it's been mentioned with the AACR over the previous month, you'll see here top link stories, pembrolizumab and AACR mentioned during last month. Okay, if we just go back again, let's have a look. Top link drugs has been mentioned with this drug 34 times within the last month. If we click on that, here we have top link stories with these two drugs mentioned together. And again, of course, you click on the headline to view the news article, and so on. So you can see here that the platform, it has very sort of extensive network with the way the technology links everything up. So whether it be companies to drugs to treatments and so on. And of course, we can always add in new companies or new uh, drug treatments whenever we are requested to do so as well. So I think I've pretty much covered the drugs, treatments, and trial side of things here. Just click on the See All 3,335. Again, I mean, you could go to, if you want to have a look at all drugs and treatments beginning with the letter S, you can see them mentioned here. But again, just shows you how thorough the service is with its coverage. And if we have a look at one more, let's go for the letter W. Probably not too many drugs beginning with the letter W, but there we go. So I think you have a good idea as to how the platform works, and particularly with regards to the drugs, the treatments, and the trials. So this is the end of this particular video demo. The next one will be on the hot topics and clinical trials. So see you in that one.